into my pump.
Good to see you.
Hi.
Just like that.
Good to see you. This is great.
Geographic remoteness doesn't have to be a barrier to getting high-quality healthcare. Technology is helping to shape NHS Shetland's healthcare landscape, with an emphasis on person-centred care and patient self-management.
NHS Shetland has put in a team of people together to concentrate on ensuring the care that we deliver is patient-centred and designed around the patient's needs.
There's some aspects of access in healthcare that's going to be different in Shetland.
NHS Shetland is increasingly using remote consultations, giving Shetlanders access to the services they need closer to home. This is one of 2 purpose-built telehealth suites at the Gilbert Bain Hospital in Lerwick. The suites regularly host orthopaedic, headache and renal clinics with specialists on the Scottish mainland. A telehealth suite is a video link between 2 fixed locations. Attend Anywhere is an NHS Scotland video chat platform for mobile devices and desktop computers. All that's needed is a good internet connection. And for those areas without adequate broadband, NHS Shetland is improving access by installing satellite internet.
A lot of feedback that we got from patients that attended either VC consultations or Attend Anywhere consultations, 96% of respondents said that they enjoyed the experience and that they wouldn't have wanted to travel instead of having an e-health appointment.
In 2016, 600 Shetlanders had a video consultation using a telehealth suite. In 2018, that number went up to 2,000 patients. That's thousands of patient travel hours saved. And for the NHS, telehealth
allows us to spend money in a more sensible way, so we're not ploughing lots of money into a travel budget.
And that means freeing up money for other, potentially life-changing technologies. Jess was diagnosed with type 1 diabetes at the age of 1, which has meant 5 or 6 insulin injections a day and twice as many finger pricks to test her blood.
When I was doing like 10 to 12 a day, it was really sore on my fingers playing my instruments.
In order to move forward with Jess's care, she decided that a pump was very important for her. So an insulin pump is just a new way of delivering insulin.
So she has no more injections, and she has a continual glucose monitor that links to the pump, so it reads her blood sugars the whole time. So constantly you can just look at the monitor and see if she's going low, then it'll switch off the pump and stop her having a hypo. And if she's going high, an alarm will go off to warn us.
It's really good.
It's not the easy fix. It's not I strap on a pump and my diabetes goes away. There's quite a lot of work involved. So there's a lot of understanding that the patient has to have of their own condition.
A lot of it's just healthy diet and everything. I don't find it hard to eat healthy. I seem to have had it my whole life.
And the new technology is helping Jess and her consultant make more informed decisions about her healthcare.
The sensor, it'll check every 5 minutes, and then it'll like lay out a line graph, and then you can look over 3 hours, 6 hours, 12 hours, and then 24 hours. And you can just see like where it's going high, where it's going low, where you can change things in the background insulin.
And Jess's data can be sent to her paediatric consultant in Aberdeen.
She'll look at it and send us back ideas, suggestions, things she might notice, and we get check-up every 3 months, and the last one is the best readings we've ever had. Yeah. So it's great.
Practicing medicine now is much more about laying options open to people and giving them the pros and the cons of different options, and then helping them come to a decision about how they want to manage their own health.
You do everything for yourself now, all the set changes, and a lot of the settings on the pump we actually don't know what they mean.
By looking at the ability to use technology-enabled care in all the different disciplines of healthcare, we are trying to ensure that we can provide everything the patient needs, provide that in a way that's convenient to them, that allows them to engage with the service, that also allows them to self-manage their conditions.
She's really adjusted to all the new technology and everything really well. Really, really proud of her.
Yeah.